Hi everyone. I polled those of you who follow me on Instagram whether you would like a video about how to correct a rotated pelvis, and a lot of you guys were interested in having that. So I'm going to briefly explain what a rotated pelvis is if you're not sure, and offer you a series of simple exercises that you can try to correct that. Of course, the best way to figure out if your pelvis is rotated and how and what's involved is to talk to your healthcare provider. So please make sure that you communicate with them so that they can help you figure out what's going on and if there's some kind of underlying issue. Let me show you from a top-down view what a rotated pelvis looks like. So here's a top-down view of my pelvis and my feet. So a rotated pelvis, when you look down at your feet, could look like this. So do you see how my right hip is going backwards? So this would be a right rotation. This would be your pelvis like looking over to the right. It could also happen like this, the other way, where the pelvis is now rotated to the left. Here's a straight line, a yardstick. My kneecaps should be facing ahead, facing forward, and my pelvis should be facing forward. But if there's some kind of misalignment, like this, for example, do you see how the line is canted to the right? So this would be a right pelvis rotation. And your belly button, which mine is here, it could also be pointed to the right as well. There are a lot of reasons why your pelvis might be rotated, and it's usually a combination of things that's going on. If it's structural, then there might only be a certain degree to which it can be corrected, but we can all work with the functional overlay, meaning your muscles, to help as best as possible get yourself into alignment so that the rest of your body can be balanced and in alignment too. To keep the video shorter, I'm going to teach you these exercises as though your pelvis is rotated to the right. If your pelvis is rotated to the left, then you would simply do the opposite side of what I say. So you would be doing the same exercises just with the opposite leg. You don't need a lot of equipment for this, just a softer surface to lie on. So you might have like an exercise mat or a yoga mat. You could do this on a carpet. And you need a chair, a stable chair without wheels, and a wall. And a yoga block or a sturdy pillow would be helpful too. So I'm just gonna grab a pillow off of my couch. Okay, just any kind of pillow. We're gonna use that for the first exercise. We're going to start lying down on the back, and you will need that yoga block or that pillow. So go ahead and take that with you. So the first step here is to take your legs off of the floor, 90-90. So your hips are bent at 90 and your knees are bent at 90. You're going to place your left hand around your left thigh, the back of the thigh, like you were gonna pull it towards you. You take the right hand on the right thigh as though you were gonna push it away from you. And then you're gonna push and pull with your hands, but don't let the legs move. So push and pull for a few seconds and then relax. Switch your hands. Left is on the front of the left thigh, right is on the back of the right thigh. Push and pull. The legs don't move. Relax. Now you need your yoga block or that pillow. So grab either of those. If it's a fairly big pillow, I'm going to try to wad it up. You're going to put that between your knees, and you're going to squeeze into the block or into the pillow with your inner thighs. So you're going to squeeze into the center, just for a few seconds, and then release. We're going to do that whole thing one more time. Left hand around the left thigh, right hand on the front of the right thigh, push and pull. Good, release. Switch your hands, push and pull. Good, and then one more time. Grab your pillow or your yoga block, put that between your knees, and you're gonna squeeze this with your knees for a few seconds. So squeeze with the inner thighs, hold that for a few seconds. Good, and then release and relax. All right, so next we're gonna go through a series of stretches for the left hip. So the way that you do this one is you sit on the floor where you already are. You can straighten both legs, and you're gonna bend the left knee and take the left foot up. We're gonna take this left ankle on top of the right knee and allow that left knee to open out to the side. So from the front, it looks like this, with the left knee relaxing towards the floor. You might very gently and kindly use your left hand and just gently add a little bit more stretch by pressing onto the inner left thigh. What we want to feel here is a stretch, a release out here on the outside of your left thigh. If you don't feel it here, then you might be able to take this stretch further, and you would do that by bending your right leg, which essentially brings this shin up closer to your chest. So you would do this. You would start to bend this right leg, and you can see how my left leg is coming closer up to me. To keep my knee more comfortable, I might flex my left foot, like pull the toes back towards my knee, and I'm feeling that stretch directly here on the outside of the left thigh. That's where we're going for. When you find it, you're gonna hold that for 30 seconds. When I hold something for a long time or I do a lot of repetitions, I will just fast forward through those, but please take your time with these. Okay, and then you're gonna release out of this stretch. Just come out of it the same way you got into it, in reverse. We're not going to repeat that on the other side. I know that may seem strange because we're used to exercising symmetrically on either side, but when you have an asymmetrical problem going on, which is what this is, we have to come at it with an asymmetrical plan of action. So we're not going to do the same things on either side. The next thing that we're going to do is stretch the top of your left thigh, your quadriceps muscles, specifically the one that crosses over your hip and runs down to your knee. And we're gonna do that in a standing position. So help yourself up into standing. So what we're gonna do is stand with our weight on the right leg, bend this left leg so the left foot comes up close to your hip behind you. And the idea here is to be able to grab your left leg and pull the heel up close to your bum so you can feel a stretch here. If it's difficult for you to catch your foot, you can go to a wall, like with the wall behind you. You can get that leg started, bending it, and put the foot on the wall behind you so that you don't have to grab it. Something that can help really get that stretch through the front line of your left thigh is to tuck your tailbone under. And you would hold this for 30 seconds. And then you would release your foot or release it from the wall. I'm gonna step it out a little bit. Okay, so for this next one, we're gonna work on strengthening the inner thigh, the inner left thigh, which is gonna actually help the hips rotate back to the left, because we're assuming that we're rotated to the right, okay? What you do is you sit on the edge of a chair, a sturdy chair, with your feet flat on the floor. You're going to allow that left foot to hover over the floor just a little bit, and then you're gonna turn your knee in. And what happens is my foot turns out. So I'm actually actively using my hip to rotate in, and then I'm just gonna slowly release and set it down. And that's one. And you're gonna do that 20 times just on this side. It can be a little bit boring, but maybe put some good music on and it'll pass the time a little bit better. If doing 20 feels impossible, then just do these to your capability and know that you can work up to 20 repetitions, and know that these should not be painful. These should be pain-free movements. Okay, next we're gonna move our attention from the left hip over to the right hip. And we have to do the same thing. We have to release muscles that are pulling the hips into right rotation, the tight ones, and then we have to strengthen the weak ones to bring everything back to the center. Again, if your hips are rotated to the left, then just do the opposite feet that I'm saying, okay? So you're gonna stand up, just move the chair out to one side, you're gonna use it again. We're gonna do a posture now that's gonna stretch the front of your right hip area here. In yoga, this posture is called Warrior One. I would do this on your yoga mat or on your carpeted surface, and you don't need a wall behind you, but I will explain why having the wall behind you can be helpful. I'm gonna turn my mat perpendicular to the wall. like it's coming out of the wall. So for this one, your left leg is going to be forward. So we're gonna come into a lunge position first, and I would like your right heel to be pretty close to the wall because you can push against it and make yourself feel more stable and get a more efficient stretch. There are a few ways to get into this. If your balance is pretty good, step the left foot forward somewhat and you step the right foot back. And you have to find a distance that's doable for you. Another way you could get into this is from the floor. You could step the left foot forward and then walk yourself up like this. And I'm gonna step myself back until I feel my heel on the wall. You could do it this way with the heel up, but you can also take this into Warrior One pose with the back foot down. So to do that, I would turn my toes out to the right somewhat, ground my heel, the whole foot onto the floor, and I still have my heel in contact with the wall back there. Front leg is fairly bent. I would push my back heel into the wall, turn my chest forward. You want to put your hands on your hips and make sure that your hips are not rotated too much to one side, to the right side in this case, or tilted. If it's really difficult to attain that with the back foot down, then don't fight it, just lift your foot back up again into a lunge. And here also, you're gonna tuck your tailbone a little bit, and I'd like you to feel stretch on the front of this right hip. You might even feel it down the front thigh again too. From the side, it would look like this, either like this, tucking, or with the back heel down. Hips forward, same thing. Hold this for 30 seconds when you feel that stretch. And then you would release. If you're in Warrior One with the heel down, lift the heel up. You can take some steps up with that right foot, so you're just standing now. The next stretch we're gonna do is for the right inner thigh and particularly the groin area. And to do that, I'm gonna give you two options. It's the same shape, but if you need a deeper stretch or a more gentle stretch, you'll have options. The first, more gentle option is to lie back down on your mat and come into what we call a half butterfly position. It looks basically like tree pose, like the yoga tree pose, just lying on your back. And the right leg would be the one opening to the right. So it would look like this. With that left leg straight, and this right leg would wing open to the right. You want to minimize the hips rotating with it. With your leg, you want to keep your hips facing up. If you do not feel it here, then you can take this a little bit further and you can do the pose in a different way. You could start lying down on your belly, and then we would have to basically come into that shape, but lying down. So I would roll to the left somewhat, take my right knee up, basically into that half butterfly position, and I would do my best to gently turn my hips towards the floor, and you can lie all the way down. And then you would hold that stretch for 30 seconds. All right, and then you would gently bring yourself out of this one. So if you're lying down on your back, bring your right knee up, bend the left leg, roll to one side. If you're on your belly, come to your forearms, roll to the left a little bit. You can straighten that right leg out. You can also come all the way down, roll to one side. And we're actually gonna end up on our side, but we're gonna end up on our left side and start some strengthening work for the outside of your right hip. Again, if you're left rotated, then you would do this on the opposite side. Lie down on your right. All right, so I'm gonna come down. It's gonna support my head like this with my hand, and we're gonna do some good old-fashioned clam shells. And the idea is to really get your outer hip on the right side to engage. I've got my legs bent at like 45 degrees, and they're on top of each other. So not quite 90, a little bit lower than that. The feet stay together. I like to put my hand here just so I can really connect with that area. And then what you're gonna do, if you're not familiar with clamshells, is you're gonna lift that right leg up as high as you can comfortably. It doesn't matter how high it goes, so don't try to get it higher and roll your pelvis open. Keep your pelvis stable and facing forward. Hold for a few seconds, like 3 to 5 seconds, and then release. That was one. This is another one that you would build up to 20 repetitions, okay? I'm going to now go through 19 more of these. Don't be surprised if you're sore the next day. The last thing that I'm going to offer to you is another seated exercise. First of all, you would help yourself up into a chair and you would sit with the right side of your body against the wall so that you could get the right knee to touch the wall. Okay, I'm just gonna show you from this top-down view on the edge of my chair so I could get my right knee on the wall, okay? My feet are down, hips width distance apart. So what I would do here is I would press the right knee into the wall. That's step one. And you should feel the upper outer right thigh engage. You can just do that part, or to make this a little bit more effective for both hips, you can do that, push your knee into the wall, and also think about pushing it forward without moving your feet, okay? So watch how I can push the right knee into the wall and also push it forward. So this one is more forward of this one. And I would also think about pulling this knee in, like towards my hip this way. So I would press into the wall, push forward with the right, pull back with the left. You would hold this for up to 30 seconds. If you can, it's harder than you would imagine. And you would do 3 sets. If it's too complicated to do all of this, then just do the right knee into the wall part. All right, so 30 seconds would pass, you would relax, okay? And you would do 2 more sets like that. I'm really trying to get that sensation of in here is working, out here is working. Hold for another 30 seconds. Let's do 1 more. Press, push forward, pull back. Hold for 30 seconds. Keep breathing, try not to hold your breath. I know this seems like a lot to do, but I'm gonna show you the after, show you how stable and aligned my hips are. All right, and then relax. Okay, and then that's it. Make sure that my feet are even. Make sure my knees are pointing ahead. You see how my belly button is facing forward? Even when I hyperextend my knees, and my knees are hyperextended now, which is not the best, but before when I did that, my hips wanted to rotate this way to the right. If you're not sure what all of this has done, I would do a before picture and an after picture of the front of your hips and see the difference for yourself, because I know it can be hard to see if your hips are actually rotated. The next thing you might ask is, do I have to do all of that? No, you don't have to do all of those things. You could just start with the stuff on the left leg, for example, but I think working around the entire pelvis as a structure is more effective and quicker. And then you might ask, well, how often do I have to do this? How long do I have to do this? And I've asked that question myself to healthcare practitioners I've worked with, and there isn't one answer, and it does depend on the underlying reason. I would just get used to what that looks like, your hips turned forward, and just make it a habit of looking at your hips and if they're turned, if they're rotated. And if you notice that they are, and these postures work with your plan of care and with your body, then incorporate these into a well-rounded regimen. Like I would still do some symmetrical exercise, some walking, some gentle yoga. I know that was a lot, but just to give you everything that I have found helpful for myself, this can help to de-rotate your hips, but oftentimes with rotated hips, it's not just that they're rotated, they could be tilted up to one side. So for example, when your hips are rotated like this, one side is typically higher, I'm just exaggerating, and one side can be like tilted forward like this, like spilling forward more. So everything we just did should help to bring the hips back to the center, but what I have noticed is that what is left over is more of this lateral tilt, like more of a tilt like this or this, right? Without knowing your particulars, but just understanding what muscles might be still locked up or weak in that case, is I would then, like let's say my hips are rotated to the right, and I just work to correct that, but then like I still noticed when I put my hands on my hips that the left was higher than the right. I would work on then stretching the left side on the side where the hip is higher because it's getting hiked up, and I would strengthen this side. Whoops. So I would do some side stretches for my left and some strengthening exercises for my right. Please let me know if this was helpful, and let me know your questions in the comments, and look forward to more upcoming videos. My next planned video is for even shoulder blade rhythm, which is another thing that you guys have been asking for. So thank you again for joining me, and take care.